Welcome, everyone, to a new episode of the Roscoe's Wetsuit Neuro Podcast. I am your host, Toby Passman. On the show with me today, we have a special guest, Dr. Wesley Willis. Dr. Willis witnessed his mother's passion as a foster care social worker with the Division of Child Welfare in his hometown. He began volunteering with the same department during his high school years. Upon graduation, he was inspired by his family to enter the field of nursing and earned his associates in applied sciences with a major in nursing from Central Alabama Community College. During undergrad, he was inspired further by several dynamic and fascinating professors in the Department of Social Work while attending Alabama State University. It was from these professors' interest, investment, and encouragement that he went on to pursue and complete a master's in social work at the University of Alabama in 2003. He later obtained a Master's of Science in Public Safety from Auburn University in Montgomery in 2004. Wesley continued his education in human behavior and obtained his Doctorate of Psychology from Argosy University located in DC in 2010. He later returned to earn a Bachelor of Science in Nursing from Herbert H. Lehman College in Bronx, New York. And Dr. Willis is currently President, CEO, and founder of RHIO Wellness, which is doing some really cool work assisting people during the pandemic, which we're going to talk about today. So Dr. Willis, welcome to the show.
Thank you. I'm glad to be on the show.
So tell me a little about kind of expanding off your bio. Tell me a little about your story of what really, you seem very passionate about what you do, the work you do. So what originally kind of fueled that fire?
Yeah, it was very interesting. I grew up in a very small town in Alabama, and kind of purview, I guess, if you will, from growing up in that small town is that's where life begins and ends. So when I went off to college, I just ran into so many dynamic people from such large metropolitan areas. That I wanted to always be in one. So when I graduated with my second master's, I moved to New York City, where I kind of was able to kind of fuel that interest and desire to reach and affect so many other people. During my time in New York City, again, like I said, I just was able to reach out, branch out beyond just being not just being, but beyond being a nurse and beyond being a social worker, to really see folks kind of on all levels of life and levels of diversity. So yeah, it just kind of has just grown to me, just really wanting to reach out and affect as many folks as possible. So RHIO Wellness was kind of like a culmination of me working for years, in different agencies, different organizations, where I said, you know what, I don't quite believe in the mission. I don't quite believe in the vision. I get the business model. The human part of me, or the businessman in me at this point, gets the business model, but I was like, it's the humans are kind of being cut out of this. And that was what kind of pushed me to create my own organization business called Reflective Healing and Inspiring Outcomes, which is why it's abbreviated as RHIO, RHIO Wellness. And so just from there, just kind of growing that, I've been lucky, like you mentioned earlier, to have a contract with the Department of Defense doing military and family life as a consultant, really helping the men, women, and families who are out here on the front lines, really trying to help us do this really, really unprecedented time. So it's exciting. Life is exciting, as we moved into this new realm.
Yeah, no, and I want to get into that in a minute, but going back to something you said about sort of the witnessing, in other companies, sort of, you said the human element, or kind of the personnel. Can you expand a little about what you mean about that missing?
Yeah, so over the course of that time, as I've worked as a director, so a mid-level manager to upper level management, and sitting in on conversations like workforce conversations about, who has to be cut, how do we how do we minimize our overhead, at the same time increase our profits, and those kind of conversations, or like going to the mental health clinics where, you know, the most vulnerable, I feel like, and unfortunately most mentally ill individuals are covered by Medicaid, Medicare, and managed care, like the lower kind of end of reimbursement, and seeing, you know, being one of those therapists who are getting double booked, or who are told, you know, you can do a 30-minute session, you can do a 45-minute session in 30 minutes, so you can then see the next person, and then that kind of being like a meal. And then how can the therapist be present if they really haven't gotten, you know, mentally through the previous session? So just those being kind of like the ways, kind of being common conversations as expectations of people who work in those organizations and who work in these organizations, and saying, you know what, there has to be a different way. There has to be a better way. How do we get all of this? I guess what you say is fat in the wheel, so much so that we have to really cut, or really offer subpar services to the folks who we say we opened our doors for.
So what were the elements that you needed to incorporate into RHIO in order to have that human element that you saw missing with some of the other companies that you'd worked at?
hmm So I think creating a lean organization, you know, is one of the main things. My assistants have always been virtual. Don't get me wrong; I definitely think there's great value in human beings, like before, like being there in person. But I think there's also, you know, people can be anywhere and get things done, and you can be just as productive. Also, over the course of the last 3 years, I have been myself and the therapists that I have hired are also virtual practitioners. So this didn't just start with us for COVID, for my organization. This started before then. So again, cutting down on that brick and mortar space, allowing practitioners to be in their own physical space, while cutting that overhead, and still being just as effective. It's so funny because I remember 3 years ago, people were like, that's not going to catch on. Being a virtual therapist or telehealth therapist is not going to catch on. COVID hit, and they're all doing it, and they're all in the predicament. Like, okay, Wesley, can you tell me what camera I need to buy? Can you tell me what system I need to buy so this can be an interactive experience? And you know, it's really funny.
Yeah, yeah. It took a pandemic, I guess, in order to change things, but
Right.
yeah, certainly have changed. So, okay, so this is really cool work that you're talking about, that you're doing with your company's
Mhm.
contracted through the Department of Defense. Tell me about just how did you originally get approached by someone at the Department of Defense? How did that project originally come about?
Yeah. So I originally actually was a contractor for a military, MHNGS, which is the military health, which is a military health association, and they were like these really larger companies who actually used to do a lot of this work. And so just kind of like learning the ins and outs of kind of how they went about doing it, to being able to do it on my own. And so again, making contacts with folks in the Department of Defense. And now, you know, us kind of getting to that point where we have such a really growing need to be able to offer services to the men and women of to the Air Force and the military and the Marines and so forth. So that's kind of how I did it. So I basically started in working for one of these companies. Being a deployed person, where I would go to like different countries, where I'd be sent to Germany or sent to Japan. I went to going to Beirut, to where I worked with families that were deployed there, through that military and family life consultants, as a military and family life consultant. So kind of like moving on from that.
Right. What were those experiences like? I mean, was that I guess just kind of seeing all different parts of the world, and
Uh,
was was that
it's
a pretty eye opening?
Definitely, definitely. I mean, going to places like Grafenwehr and these small towns where there are United States Air Force bases or United States bases and service members was definitely very eye-opening. Sometimes it'd be, a very like metropolitan or urban kind of like placement to being again, a very rural placement in Germany and kind of helping service members adjust to that kind of life, being like sometimes a year, 2 years away from their family in a very cold area of Germany, in Frankfurt, Germany, or something like that. So it was a very eye-opening experience. I've always loved international travel, so I think it just kind of added to that to be able to kind of go to these places and be given like room and board and accommodations, and also at the same time from 9 to 5 treat and see service members and their families.
Right. Yeah, incredible. So going back to the current project with the Department of Defense, so
Mhm.
you, you I believe before we started airing, we talked a little about it's basically a project to assist people being affected by COVID.
hmm Yeah, so with the again with the growing numbers of coronavirus cases across the United States and the limited resources as being frontliners, service members are called in to fill in the gaps because you only have but so many nurses, you only have but so many doctors, you only have but so many policemen who can be a part because we all play really a significant part in this, not just the doctors and the nurses, but corpsmen who have some level of training to be able to help manage the symptoms and help manage that. And so again, being put in a predicament where they never had expected. I myself have lost several physician friends, several nurse friends, several healthcare friends who have died during the pandemic that I know personally and worked side by side during this experience. And when people hear those experiences, especially I think service members, because again, they only have but so much training, is fearful. Like, will I go back? I can see my family. The holidays are here, so that's even more so pressing that I'm now stationed, called away to my family to help with the pandemic, growing numbers in Texas, and how safe is that? To that plays on a lot on your mental health. So yeah, so that's what's kind of going on. Is kind of like helping them process and transition, and helping their families, like be hopeful about the future and optimistic.
Right. Yeah. So talk to me about just like the challenges that you've noticed. Like, I guess so.
Mhm.
I mean, both just in terms of the actual work, but then also just psychological. It's got to take quite a toll on people. Like, is there anything like as far as what you guys do? Is it more so kind of just putting stuff together, or is there also like sort of psychological assistance provided?
Yeah, definitely the psychological assistance. So, foundationally, my practice is centered around cognitive behavioral therapy. So again, some people would say positive psychology, I guess is the more kind of just layman's way of saying it. But yeah, it's centered around really cognitively processing what's going on in our head. Like, we talk about things very, very just kind of um, concrete things like fortune telling, predicting that the outcome of your deployment is going to be negative, or not going to be a very kind of like successful experience. So we look at kind of like, again, journaling is a significant part of that, because as much as we would love to think we were robots, we have other things going on in our head that are coloring our viewpoints of the world, that affects our own emotions. So when people or soldiers are sitting, in their quarters and they're confined, all they sometimes are left with is their thoughts, because they're not getting the information that we don't have. Let's just be honest. Sometimes I feel like we have just as many answers today as we did when this pandemic first kind of like broke out. So, you know, and I would never say that, you know, people's or ideas of reality is not in touch with what's going on, but just sometimes really reframing that for ourselves in a very more rational way, so that we can be mentally healthy, be present. Again, things like meditation is so important about to kind of stay present in current day, as opposed to thinking about, well, you know, things that we have no control over. So we use things like meditation and mindfulness, recognizing when our body is saying, you know, to ourselves, when our heart's racing, our head is racing, to kind of say, you know, self, pull yourself out of this. What are those messages, self-talk, if you will, that are going on in our brain, and kind of like mute those, or at the same time change that narrative that's in our head.
Right, right. So have you seen a lot of success, like kind of implementing cognitive
Mhm,
behavioral therapy and meditation with people, like, and just in terms of their ability to handle, because
mhm,
obviously the stressor is still there, as we're
mhm,
talking about. It's like with COVID, it's still going on in full force, but people's ability to sort of handle that stressor, it
mhm.
sounds like you're kind of helping to give them some of the tools to do so.
Right. Definitely. Definitely. I mean, I think about some of the, not in this experience, but in my experience where people are stressed to the max. And like, say, for instance, again, like I said, not in this experience, but in other experiences where like a service member or a civilian, I can't remember which one it was told by a superior, you know, that when after messing up, I'll shoot you in the face, or, you know, shoot you in between the eyes. And and probably not for nothing was not meant, but the service member really being such a traumatic being conversation by a superior who by all means could have been, you know, could have had that intent, and then now processing that fear and that anxiety and that shame that was now brought onto them in front of other people, you know, and saying, I don't want to be here, this is awful, or feeling like, you know, a scared, again, and this is not the time to kind of be scared. This is the time to be as, you know, opportunistic, and or not opportunistic, but as optimistic as possible, because they're, again, helping individuals who are already like sick, and say, you're going to make it, and give them some hope, when you're already hopeless yourself, as a frontliner. That can't be good for the people that you're going to work with.
Right, right. So switching gears a little bit, I was curious. Tell me what got you to want to, come on podcasts, do this sort of speaking, because you're sort of in the midst of the job,
Mhm.
this intensive sounding job right now. Why is it important for you to kind of share your story?
So I was fortunate, because as a telehealth practitioner, 3 years ago, when I set up my office in my practice, and I created this kind of like basically studio, interactive studio, I was thinking like, wow, this message can be so much greater, can be so go so much further than the 40, 50, 60 patients that I'm treating, to a more kind of like global movement, where, again, it's greater education and stuff like that. So I created like a YouTube channel, and like have over like 10,000 subscribers, and the like, because I think that what happened before then even, was that as therapists, we were expected to be in our silos, for fear that, partly because, one, um, if you have this risk of disclosing patient information, then the repercussions of that, but also to kind of like the kind of like, let's just be honest, mental health is one of the most broadest areas with the mind. We know not a whole great deal about, versus you could be, you know, a diabetic practitioner, or you could be a cardiologist. And those are very kind of prescribed ways of thinking. There's a laid out plan that says you're right or you're wrong, versus like mental health is very kind of like a lot of gray areas. So I think that a lot of us, or a lot of messages that I received before kind of being more public, in the public eye, and doing things like this and doing things like live streaming and television stuff, was to you don't really talk about it. Uh, I mean, again, because of those reasons. One, it may also be considered boastful that you're holding yourself out and talking about the work that you do. You know, you really are no better than the other than therapists next to you. So yeah, so that's kind of like why I started kind of going into this area.
What's some of the feedback that you've gotten just from doing these different talks, or going on different podcasts? Like, do you get a lot of people who come up and say, you know, oh my gosh, you know, I do similar sort of work and I
Mm-hmm.
relate to this. Like, thanks for sharing your story. Is that a common experience?
A very common experience, a very common experience, especially amongst millennials who are either new to the field or also looking to kind of bring some type of conversation and broader dialogue to affect change. I think it's been well received. At the beginning, it wasn't so well received. I feel like, because I think also my audience, my focus was really more on professionals that I had already had built experiences with. And they had years and years of kind of like this layers of feelings about kind of like how the practices and how psychotherapy practices should operate, to now of a more kind of like more forward and progressive thinking group of folks, professionals, practitioners, who are really truly embracing technology, embracing the need for these type of modalities for reaching people.
Sure. So what do you see as like sort of the going forward, both in terms of, you know, dealing with the COVID situation, but along with just what we
Mhm.
talked about with sort of telehealth and sort of all the virtual medicine stuff that's going on? Like, what's the next direction, and where do you sort of see this sort of stuff going?
A part of me wish I knew. I know that I've been lucky to be part of conversations of about hospitals without walls, creating more of a sim kind of hospital situation, which will be very interesting, where patients have avatars. Again, so that they can be, you know, do things distantly. I'm
Wait, talk to me
really.
about that.
Uh-huh.
They have avatars?
Yeah, yeah. So there is some growing interest and investments in creating what people call sim hospitals, to that will hopefully take advantage of the hopefully VR kind of stuff that's like growing, the virtual reality stuff. So people are again sitting and seeing a cardiologist and having the look and feel of being in a in a in a in an office, in a clinic, without kind of leaving the comfort of their home. So that is kind of like, you know, I've seen, talking to the investors, I guess, in that, who are like actually part of these CEOs and former CEOs of large managed care companies, insurance companies, who are really taking this to task, this new way of delivering healthcare. And I think that that's going to be more. I think that what I've seen. I feel like there's been fast forwarded. Like there's been like this kind of like, hey, let's put our foot to the gas and make this now versus later. Especially when you think about how, again, with all the whole COVID thing, a lot of things like outpatient surgeries, clinics have been closed, because again, congregating people in one space, in one place, is not considered safe. So how, you know, as an ambulatory surgical center, or as a place where you normally have like lots of people coming in for pre-admission testing and talking to clinicians, now they're seeing clinicians in a kind of a virtual reality space.
How how far out, I mean, since you've been like meeting with these people who are actually involved in doing this, is like, do we have the technology right now to implement these ideas or?
Mm-hmm. Yeah, so I mean, I wouldn't be surprised if actually we see this next year. I've been luckily to be in conversation with, like I said, some people who are doing it and seeing the build out, and I'm like, wow, this is really, really magnificent. And I think like when I saw the Facebook release for the virtual reality that they've done, like just in the last 2-3 months, is just kind of again building on that and kind of like slowly releasing those kind of like releasing those opportunities and this new technology to a broader audience.
Right. Yeah, that should be super fascinating. I mean, if that's able to reduce people's need to actually be in a hospital if they're sick,
Mm-hmm.
and be able to isolate more, I mean,
Mm-hmm.
that could seems like it could be a game changer.
Hmm. Hmm. I mean, we've always had nurses, we've always had practitioners who go to patients' homes in a very kind of just really just traditional sense. But to be the ability to also be able to, like, there's the thing with VC where there is the patient actually can there's a virtual stethoscope, and you can hear your patient's heart sounds utilizing a virtual stethoscope in a virtual clinic, and different, and be able to monitor your patient kind of like in that particular sense, so you can alert the frontline practitioners, hey, this patient needs to be a priority today, because I kind of hear something, they're wheezing, and or they're wheezing, or there's an extra heart sound, and I really don't like where their heart failure is going, because we've always been kind of like doing this where we identify patients in the community that suffer from like these really chronic conditions, one being things like heart failure, because we know that it's a chronic condition and they can be managed in the community with the right access and the right tools and the right people involved in their care. And it's just kind of really about putting all of these practitioners together who have been kind of siloed, so, and helping to kind of like everybody's like speaking one language.
Is this going to be like a service that'll start out being like super like pricey, that only like the sort of upper tier, uh, very rich people will be able
Hmm.
to afford, and then it like a lot of new technology where it starts off like that and then comes down in price? Or is it like who are the companies that are working on this?
Hmm.
Who's their target?
Hmm. So from what I've just assessed, I feel like it's one of those mid-range kind of things, kind of in terms of pricing, and I guess what's mid-range, right? Uh, is the question. So I really don't see it being as an out of reach type of technology that's not available to the common person, but definitely one of those things where individuals have to have unfortunately, some level of ability financially to kind of like to spend money into this area, because I think that again, with any normally new treatment or new thing, other insurance companies are kind of like, well, before we approve this, we're going to see if it really shows to be effective. So people might say, well, I have a certain amount of income that allows me to be able to invest in this as a part of like taking advantage for like my next steps. Look, I feel like kind of like what mental health was, where there were people in the beginning, not in the beginning, but years and years ago, that mental health wasn't a part of the insurance plan. That if you needed to see a mental health practitioner, you had to pay out of pocket. And then parity coming and making that against the law. You cannot give a person health insurance and say that mental health is carved out of that. And see that and start seeing this as kind of like a really necessary part of patients' health. So that's how I kind of feel like this is going to progress itself, as individuals who say, you know what, I have like this amount of money, like $1,000 to $5,000 to invest in this, so that I can, be able to see my cardiologist or be able to see my gastroenterologist, and talk about things that are going on in a more uh was in a more organic way, because sometimes the Zoom thing, it feels, if it's okay for some of us, and then my more baby boomers, they're like, I don't like getting on this thing. So I think that it's going to be more user friendly, but it's going to have a cost to it.
Got it. Well, Dr. Willis, I've really enjoyed our discussion today. Anything that we haven't covered that you'd like to touch on before we wrap up?
None that I can think of. I really enjoyed this conversation. I always have a great time talking about it, and I really appreciate the opportunity to come on and talk with you about this today, Toby.
Absolutely. Well, if people want to find out like more about your work,
Mhm.
more about like the podcast appearances or videos that you've done, where can they find you?
Yep. So I have a website called thenursedoc.com. So one word, thenursedoc.com. And that was kind of partly because I'm a nurse and I'm also a
No,
psychologist.
I love that. That's a I'm surprised you got that name. I feel like that's like a gold website name right there.
It's so funny because I have actually, so when I made a Good Morning America appearance, and I got some mixed reviews, some mostly that were good though, uh from nurses who are also at the same time, some nurses that I know that are also physicians, who were like, I wish I had thought of that first. I'm like, I'm sorry, you don't want to talk to my intellectual law attorney to deal about this. So yeah. And yeah, no, but thank you. I definitely feel fortunate to kind of like been able to build this brand as the Nurse Doc. So I'm also on YouTube as the Nurse Doc, and on all across all social media platforms as the Nurse Doc. I usually do a weekly, when I'm more able to be in the studio, my studio, a weekly conversation and dialogue around mental health and well-being on a weekly basis every Friday morning at 8:45 Eastern Standard Time across those platforms. So
Awesome. Awesome. Well, for those listeners who enjoyed the show, go ahead and like and subscribe to our YouTube channel. We're Roscoe's Wetsuit Neuro Podcast. You can also find audio versions of the podcast available on Apple Podcasts, Spotify, Stitcher, just about anywhere else audio podcasts are available. Also, go ahead and check out all this stuff at Roscoe's Wetsuit Podcast.com. Dr. Willis, again, thank you so much for coming on the show today.
thank you. I really, really, truly appreciate it.
Absolutely.